the Iowa Department of Health and Human Services hosts the Nutrition and Aging Resource Center. Essentially what we do is we are a resource center, so we house resources, whether that be tip sheets or webinars, to help the senior nutrition program. So if you're an area agency on aging, a state unit on aging, or a local service provider, we survey the network to find the best practices and tools that are ready to use so you don't have to do the digging, you can use them. So we partner with Iowa State University and an organization called NANASP. So we have a team of about 11 people plus contractors to help your organization.
Tell us about the why and motivation behind your project.
So as a state unit on aging in Iowa, we provided a lot of assistance to our area agencies on aging through COVID and just to help innovate their programs. So when we applied for the Nutrition and Aging Resource Center, we thought there's a lot that Iowa's doing to innovate the congregate meal program. We can share this information nationwide. We can try to use these tools and replicate them to be more applicable for other senior nutrition programs. And we just wanted to share the news. And I think a lot of people in the senior nutrition program network, they're very caring people. We are too. We just really care about our staff and volunteers and our older adults, and we're just here to help and elevate the voices of other successful programs.
What has been your biggest challenge? How have you pivoted to turn this into a success?
The biggest challenge is, you might have heard the phrase, if you've seen one senior nutrition program, you've seen one senior nutrition program. That's very true. Every state, every area agency on aging, every local provider functions very differently. We all have different challenges and opportunities across the nation with who are audiences that we're trying to connect with. So a challenge, which is of course always an opportunity, is to really create resources that work for everyone. So that's clearly not possible. A lot of people are very busy. We have limited time, limited funds. We try to create a tiered approach to our resources so that they can be short and digestible for those who are just quick on the run, or they could be like a longer video or a longer report if you really want to dive into the weeds. So we try to, again, create a tiered approach to education so that everyone can access it on their time.
What do you wish you would have known prior to beginning the project?
When we received this grant, we were ecstatic, obviously. It was just myself and Dr. Sarah Francis, and we didn't have the team structure in place yet. So we were very excited. We had a big shoes to fill, lots of need out in the network, and we just needed to hit the ground running. So I think what I probably didn't take into account is the time it takes to build a good team. But as everyone can tell you, your team members, your staff are your biggest assets. And having that time to build a really strong, solid team and build the people around you and talk to whoever it might be, partners, stakeholders, your local government funders, it's really important to have good people support. So building in that time to do that administrative effort is really important.
What is one thing you want people to know about the Nutrition and Aging Resource Center?
One project we launched last year that I'm really excited about is called the Instructional Campus on Aging Nutrition. If you have not seen it, it's also called ICAN, so it can be catchy, but it's 10 modules really geared towards local staff, local volunteers about the basics of the Older Americans Act Senior Nutrition Program. So that's the first thing I recommend people check out when they check out our website, is go on there, take a course. They're less than 30 minutes in length. We have some smaller videos on our YouTube channel that are 1 to 2 minutes in length, but if you're a new program staff or if you're working with new program staff and you're really struggling with how to give them a good foundation, check out ICAN.